Let me ask you a bold question. When was the last time you had an erection that made you feel like a man again? The kind of rock-hard strength you used to take for granted? If you're over 60 and that memory is getting distant, you're not alone. But what if I told you it doesn't have to stay that way? I'm Dr. Rena, a urologist with over 30 years of experience helping men just like you restore their confidence, vitality, and sexual power. I've spent decades studying what works and what doesn't, and I can tell you right now, most men are focusing on the wrong things. Pills may mask the problem, but they don't fix the cause. What if I told you that 4 simple exercises, yes, just 4, could reactivate the exact systems in your body responsible for strong, lasting erections? And the 4th one? It's so rarely talked about, you won't hear it from your regular doctor. But it might be the most powerful of all. In the next few minutes, I'm going to show you how these exercises can increase blood flow, restore pelvic strength, and rebuild the kind of stamina you thought was gone for good. And near the end, I'll reveal a proven method quietly used in sexual rehab clinics that could take your results to the next level. Let's begin. Before we get started, make sure you hit the subscribe button and turn on the notification bell so you never miss a single tip that could help restore your confidence, strength, and vitality. And if you find this video helpful, type 1 in the comments. If not, type 0. Your feedback helps me create content that truly supports your journey to better health. Exercise 1, the foundation, Kegel exercises for men. For many men, especially those over 60, the idea of doing Kegels sounds unfamiliar or even unnecessary. But make no mistake, this simple, often overlooked exercise is the foundation of stronger, longer-lasting erections and better sexual control. It's not just for women. Kegels, when done correctly, strengthen the pelvic floor muscles, specifically the bulbocavernosus and ischiocavernosus. These are the key muscles involved in achieving and maintaining an erection, controlling ejaculation, and even supporting healthy bladder and bowel function. Here's what's happening inside your body. With age, the pelvic floor weakens, especially if you've lived a sedentary lifestyle, dealt with prostate issues, or experienced long-term stress. As those muscles lose strength, so does your ability to maintain firmness, control your climax, and feel confident during intimate moments. But just like biceps or legs, these muscles can be trained, and when they are, the results can be extraordinary. To get started, you need to identify the right muscles. A simple way to find them is to try and stop the flow of urine midstream. The muscles you contract to do that are the same ones you'll be strengthening with Kegels. Once you've located them, perform this basic routine. Tighten the muscles and hold for 5 seconds, then relax for 5 seconds. Do this 10 times in a row. Try to work up to 3 sets per day. You can do them sitting, standing, even lying down, and no one will ever know you're doing them. Consistency is key. Within just a few weeks, most men report a noticeable difference, not just in the strength of their erections, but in how long they can last and how much control they feel over their sexual performance. The beauty of Kegels is that they can be done anytime, anywhere, and the payoff? Stronger pelvic support, better blood flow, enhanced sensitivity, and a powerful boost to your confidence. If you've been looking for a natural, medication-free way to reclaim your sexual strength, this is your starting point. No gimmicks, no side effects, just your own body working the way it was designed to. Now, while strengthening the muscles is vital, the next step is about increasing blood flow, flooding the penis with oxygen-rich circulation that creates those firm, full erections you've been missing. And to do that, there's one simple device that's helped thousands of men retrain their bodies for better performance. It's easy to use, surprisingly effective, and often misunderstood. Let me show you how it works in Exercise 2. Exercise 2, the blood flow booster, penile vacuum therapy, VPT. Now that we've strengthened the foundation with Kegel exercises, it's time to address another critical factor in sexual health, blood flow. Without healthy, consistent circulation, even the strongest pelvic muscles can't produce a full, lasting erection. That's where penile vacuum therapy, or VPT, comes in. While it might sound complicated or even intimidating at first, this simple, non-invasive therapy has helped countless men restore firmness, confidence, and natural function. Penile vacuum therapy works by creating a gentle suction around the penis using a specially designed cylindrical pump. This suction draws blood into the penile chambers, mimicking the natural process your body uses during arousal. Over time, regular use of a vacuum device doesn't just help generate an erection in the moment. It actually trains the blood vessels to respond better, improves oxygenation of the tissue, and supports long-term vascular health. It's like physical therapy for your erection. To get started, the pump is placed over the penis and a seal is formed at the base. The device is then activated, either manually or automatically, to create negative pressure. Within minutes, blood is pulled into the penis, creating a firm, visible erection. Some men choose to use a constriction ring after the pump is removed to maintain the erection during intimacy, although that step isn't required for therapy alone. For best results, most protocols recommend using VPT 2 to 3 times per week for about 10 to 15 minutes per session. Some men build up to daily use, but never exceed 30 minutes to protect the delicate tissue. One of the most exciting parts about vacuum therapy is how well it pairs with other treatments. Studies have shown that when combined with medications like tadalafil or with regular pelvic floor training, the results are significantly better than with any single method alone. In fact, VPT is often used in post-prostate surgery rehabilitation to help men regain spontaneous erectile function. That's how powerful this therapy can be. It's important to use the device correctly and under the guidance of a healthcare provider when starting out, especially to avoid complications like bruising or discomfort. But when done right, it's one of the safest and most effective tools available for older men looking to improve their sexual health without relying solely on medication. And if you think that sounds impressive, wait until you hear about the next method. It's something most doctors won't even mention. Yet it's been quietly used in clinical settings to restore function, increase length, and completely transform a man's sense of power and pride. Let's explore that hidden gem in Exercise 3. Exercise 3, the unknown secret, penile extender traction therapy. If you've never heard of penile extender traction therapy, you're not alone. This method is rarely talked about in everyday medical conversations. But among specialists in men's health and sexual rehabilitation, it's a powerful tool that deserves far more attention. In fact, it's one of the few non-invasive techniques that doesn't just support better erections. It can also lead to improved sensitivity, increased vascular health, and in many cases, a modest but meaningful increase in length over time. Penile extender traction therapy works on a simple but effective principle. Applying gentle, consistent stretch to the penis stimulates a natural process called tissue remodeling. Over time, this low-force traction encourages new blood vessel formation, collagen growth, and greater elasticity in the penile tissue. It's the same principle used in other areas of medicine, like limb lengthening and scar remodeling, adapted for male sexual health. The device itself is discreet, mechanical, and adjustable. It's worn over the penis, often under loose-fitting clothing, and gradually stretched based on your tolerance. Most protocols recommend starting with 30 to 60 minutes a day, slowly increasing to 1-2 hours as your body adapts. What's important is consistency. This isn't a quick fix, but over a period of 3 to 6 months, many men report significant improvements not only in their erections, but in their overall sexual confidence and self-image. Traction therapy is particularly useful for men who've experienced changes after prostate surgery, or those dealing with conditions like Peyronie's disease, where scar tissue affects the shape and function of the penis. But even without underlying medical issues, men over 60 can benefit from this kind of therapy as part of a broader routine to reclaim sexual vitality. It's not about chasing unrealistic ideals. It's about strengthening what's already yours and using science to take back control. As with any device, it's crucial to follow a trusted protocol and ensure the extender is properly sized. Incorrect use can lead to irritation or discomfort, so I always recommend speaking with a specialist before diving in. That said, when used correctly and consistently, penile traction therapy is a quiet powerhouse in the world of male sexual wellness. And now that we've covered the internal muscles and direct therapies, it's time to look at something a bit more holistic. A simple daily movement that activates your entire cardiovascular system while strengthening the pelvic floor in a completely natural way. It's easy, energizing, and often overlooked. Let's walk right into Exercise 4. Exercise 4, the full body catalyst, cardiovascular power walks with pelvic activation. Sometimes the most powerful solutions are the simplest, and when it comes to reviving sexual health, nothing jumpstarts the body quite like a focused, intentional walk, especially when paired with pelvic activation. Cardiovascular power walks with pelvic engagement are one of the most effective and accessible ways to support erections, stamina, and overall vitality. They don't require equipment, a gym membership, or even privacy. Just your body, your breath, and a little commitment. What makes this exercise different from an ordinary walk is the purposeful engagement of the glute and pelvic floor muscles while moving. As you walk briskly, every 10 steps or so, you gently contract your glutes and the muscles you learn to activate during Kegels. This subtle squeeze strengthens the pelvic floor in motion, trains your core, and activates circulation in the lower body, all while keeping your heart rate in the ideal range for nitric oxide production, which is essential for achieving and maintaining an erection. The benefits go far beyond the bedroom. This type of walking reduces inflammation, regulates blood sugar, boosts testosterone levels naturally, and helps manage stress, one of the most common silent killers of sexual desire and performance. And because it increases oxygen-rich blood flow throughout the body, it directly enhances penile circulation without the side effects or risks of medication. To get the most out of this practice, aim for at least 30 minutes a day. Choose a route that allows for steady, uninterrupted movement. Walk with purpose. Head up, chest open, and arms relaxed. Breathe deeply through your nose, and with every few steps, gently engage your glutes and pelvic muscles for a few seconds at a time. This rhythmic activation, combined with cardio effort, creates a full body effect that builds endurance, strengthens key muscle groups, and supports vascular health. Many men underestimate how deeply connected cardiovascular health is to sexual performance. In reality, the arteries that feed the penis are among the smallest in the body, and often the first to show signs of dysfunction. By prioritizing daily movement, you're protecting those vital pathways and reinforcing the physical foundation of healthy, spontaneous arousal. And here's the good news: you don't have to do all 4 exercises perfectly to see results. But when you bring them together in a simple, consistent routine, the transformation can be life-changing. So how do you take everything you've just learned and put it into motion starting today? Let's break it down step by step in the next section. Putting it into action. 5. Putting it into action. Now that you understand the 4 most effective exercises to restore sexual strength and improve erection quality, the next step is simple, but it's the one that matters most. You have to take action. Knowing what to do means nothing if it isn't applied consistently. These movements and therapies aren't magic tricks. They're part of a system, a daily practice that helps your body rebuild what time, stress, and inactivity may have taken away. And the best part, you don't need expensive medications or complicated routines to begin. You just need a plan, a little discipline, and a reminder that you're doing this for you. Start small and build from there. Begin your mornings with a round of Kegels. Take that 30-minute power walk in the afternoon, breathing deeply and engaging your pelvic floor as you move. Schedule your vacuum therapy sessions a few times a week, ideally when you're relaxed and unhurried. If you're using a penile extender, make it part of your quiet routine, an hour or 2 while you read, work, or wind down at home. Don't wait for the perfect time. The perfect time is now. Even a few minutes a day, consistently practiced, can create momentum. The key is not intensity, it's routine. If you've struggled in the past with follow-through, don't beat yourself up. This is a fresh start, and it doesn't require perfection, just intention. Set a reminder, track your progress, celebrate the small wins. Feel a little more strength after week 1? That's progress. Notice more morning firmness after 2 weeks? That's your body waking back up. Every step you take, every repetition is part of reclaiming something incredibly personal. Your vitality, your confidence, your sense of control. It's also worth remembering that these exercises work together. The more consistently you practice, the more each one amplifies the next. Kegels support vacuum therapy. Power walks boost blood flow and reinforce traction results. Everything you're doing is part of a bigger system that's built around restoring your body's natural ability to perform and feel alive again. And if you really want to maximize the impact of these exercises, There's one more powerful piece of the puzzle you shouldn't overlook, because what you put into your body matters just as much as how you move it. In the next section, we're going to talk about specific foods and nutrients that naturally enhance circulation, hormone balance, and erectile performance. And some of the results might just surprise you. Let's talk about that in bonus, nutritional support. 6. Bonus, nutritional support. Exercise alone can create powerful change, but to truly optimize your results, you have to consider what's fueling your body from the inside. Nutrition plays a critical role in blood flow, hormone production, and even your brain's ability to communicate with your sexual organs. In fact, many of the gains you're working so hard for with Kegels, vacuum therapy, traction, and power walking can be amplified or held back, depending on what you eat. The good news, you don't need a complicated diet or expensive supplements. Just a few strategic changes can make a noticeable difference in your performance and recovery. Start by prioritizing foods that support nitric oxide production, which is essential for proper blood vessel dilation. Beets, spinach, and arugula are rich in nitrates that help open up blood vessels and improve circulation to the pelvic area. Add in pomegranate juice, which is loaded with antioxidants and has been shown in several studies to improve erectile function naturally. Watermelon is another excellent choice, thanks to its citrulline content, which your body converts into arginine, another key player in blood flow regulation. Healthy fats are also essential, especially for older men. Omega-3s from salmon, mackerel, or walnuts can help reduce inflammation and support cardiovascular health. Pair those with foods rich in zinc, like pumpkin seeds or shellfish, to aid testosterone production, a hormone that plays a major role in libido and stamina. Dark chocolate in moderation can also be helpful, thanks to its flavonoid content, which has been linked to improved circulation. On the flip side, you'll want to limit or eliminate foods that work against your goals. Processed meats, high-sugar snacks, excessive alcohol, and refined carbs all contribute to systemic inflammation, insulin resistance, and reduced blood flow. These aren't just bad for your heart, they're a direct hit to your sexual performance. Proper hydration is equally important. Your blood needs to be fluid and your tissues well oxygenated. Dehydration makes everything harder, literally and figuratively. Aim for half your body weight in ounces of water each day and make it a habit, just like your exercises. When combined with the 4 exercises you've just learned, these nutritional adjustments can lead to faster recovery, stronger erections, and better long-term results. You're giving your body the tools it needs to perform, repair, and respond the way it once did. And now that we've covered the complete system, from muscle training and blood flow to daily movement and proper nutrition, there's one final message I want to leave you with. It's something I tell every man who walks into my clinic feeling discouraged or uncertain. Let's bring it all home in the closing section. Closing message from Dr. Rena. If you've made it this far, I want you to hear me loud and clear. You're not alone and you're not past your prime. I've spent over 3 decades working with men in their 60s, 70s, and beyond. And the one thing I've learned is this: the fire doesn't fade with age. It just needs the right spark to come alive again. We've talked about 4 powerful exercises: Kegels to rebuild your foundation, vacuum therapy to restore blood flow, penile traction to recondition your tissue, and cardiovascular walking to fuel your system from head to toe. We've explored the foods that support your body's natural ability to perform, and how even small choices each day can lead to lasting change. But beyond the science and routines, there's something deeper at work here. This is about reclaiming something that matters. It's about walking into a room and feeling confident again, not just in your body, but in your presence. It's about reconnecting with your partner in a way that feels strong, intimate, and real. And most of all, it's about proving to yourself that you're still capable, still powerful, and still full of life. Don't wait for permission. Don't wait for things to get worse. Start now. Make today the day you decide to stop settling for less and start rebuilding the man you know you still are. You've got the knowledge, you've got the tools, and you've got a doctor in your corner who believes in what's possible for you. Keep going. Keep showing up. The best chapters of your life might still be ahead.